HIV stands for Human Immunodeficiency Virus. The virus attacks certain white blood cells that fight off infections and illnesses. This can weaken a person's immune system, making it less effective at protecting the body. If it's left untreated, HIV can lead to a more serious condition called AIDS, Acquired Immunodeficiency Syndrome. A person with AIDS is vulnerable to other infections, including tuberculosis, pneumonia, certain types of cancer, and more.
HIV can be transmitted when someone has unprotected sex with a person who has HIV, from sharing needles for tattooing or injecting drugs with a person who has HIV, or from breast milk if the mother has HIV. People can also be born with HIV if the person who gives birth to them is living with the HIV.
HIV can only spread through contact with specific body fluids: blood, semen, vaginal fluids, and breast milk. So it's usually transmitted through sex or sharing needles.
PrEP stands for Pre-Exposure Prophylaxis. It's a medication people at high risk for HIV can choose to take. When taken daily, PrEP is highly effective for reducing the risk of acquiring HIV through sex or injection drug use. PrEP can only be prescribed by a healthcare provider, and an HIV test must be taken before beginning PrEP and then every 3 months when a person is taking PrEP, to be sure the individual doesn't already have HIV.
It's important to know that PrEP is not a vaccine against HIV and does not provide any protection against other STDs. So, use a condom or get tested for STDs regularly while on PrEP.
When someone learns that they have HIV, they may experience a whole host of feelings. Some may feel confused, vulnerable, or scared. Others may feel sad or upset. Some may see the situation as unfair, which could lead to feelings of anger or depression. Everyone's reaction is different, but all are completely normal and part of the process of accepting life with a chronic or long-term illness. Doctors don't have a way to cure HIV yet, but they are working on it. And if a person takes care of themselves, they can live a long and healthy life with it. Medicine used to treat HIV is called antiretroviral therapy, or ART. Seeing the doctor regularly and taking the medicines as prescribed, exercising regularly, reducing stress, getting enough sleep, and eating healthy foods can help someone living with HIV to live a long and healthy life. People living with HIV can do the same types of exercise as people who do not have HIV. Playing on a sports team is a great way to stay fit, to reduce stress, and to be social. There are state and federal laws that protect the rights of people living with HIV, including the right to participate in school activities and sports. People living with HIV can also be in relationships and have sex by taking a few precautions, like making sure their medications are keeping their HIV in check, using condoms if they do have vaginal or anal sex, and if their partner does not have HIV, helping them to get a medication called PrEP that can prevent HIV transmission from one person to another. Sometimes a person living with HIV may feel isolated or alone, like they're the only one in school who has this experience. Deciding to tell friends or classmates can help someone living with HIV to feel less alone, but it is a very individual decision whether or not to tell people, and should be theirs alone to make. It's okay if they decide not to tell people about their HIV status.
I wanted to tell you I'm living with HIV.
Oh, okay. Wait, what? Does that mean you're sick? Like having cancer?
No. Times have changed, and now HIV is treatable with medications. Living with HIV today is more like having diabetes than having cancer.
Oh, I get that. My mom has diabetes. She just takes some medicine, goes to the doctor, and keeps an eye on things. Is that all you have to do?
Pretty much. In fact, I'm about to blow your mind. If someone living with HIV gets treated, doctors can give them medicine that keeps the viral load so low that it's undetectable. I still have HIV, but when I'm undetectable, the HIV is untransmittable, meaning I cannot transmit HIV through sex. It's called U equals U. Undetectable equals untransmittable.
It is so sexy when you explain science to me. Keep going.
Well, thanks to the medication I take every day, along with regular checkups, it keeps me healthy and stops the virus from being able to spread. If I don't follow the medication instructions, I could start transmitting HIV again. It could also impact my health and make it easier for me to get sick.
So, what about, is it safe for us?
Yes, there's no risk of transmission when I'm undetectable, even if we have sex, and even if we do not use condoms. Whoa, hold on there. I still prefer to use condoms anyway.
Why?
Because condoms protect against other STIs, and, well, also against pregnancy, of course.
Right. No babies for now.
PEP stands for Post-Exposure Prophylaxis. It's a medication people use if they think they've recently been exposed to HIV through sex or injection drug use. PEP can only be prescribed by a healthcare provider or an emergency room doctor. PEP should only be used in emergency situations and must be started within 72 hours after a recent possible exposure to HIV. So it's important to talk with a medical professional as soon as possible after the exposure. If prescribed PEP, a person would need to take it every day, once or twice a day, for 28 days. PEP also does not provide any protection against other STDs, so a condom should be used every time a person engages in sexual behaviors while on PEP.
And now, to our contender, Christy. We will give her statements about HIV, and Christy will have to choose whether they are true or false. Are you ready, Christy? Here is your first statement. You can tell by looking at someone whether they have HIV. You are correct. The only way to know if a person has HIV is to get an HIV test. Second statement. You can get HIV through casual contact or being near someone with HIV. You are wrong. Oh, HIV can only be spread through bodily fluids. It can be transmitted through sex by sharing a drug needle or being breastfed by someone who has HIV. If a pregnant woman is living with HIV and doesn't get the proper treatment before giving birth, her baby could be born with HIV. You cannot get HIV from sharing a glass, hugging, or sharing a bathroom with someone who has HIV. Okay, and now for the final round, the quick round. Here is your statement. This product can prevent a person from getting HIV. Condoms, birth control pills, a medicine called PrEP. You are correct! You got them all right! When you have sex, condoms can help provide protection. And for people at high risk for HIV, a doctor can now prescribe a medication called PrEP that can be taken to lower their risk. And we have a winner! Tell her what she won. You win an HIV home testing kit. And for all you back home, remember, once you begin to have sex, it's important that both you and your partner get tested for sexually transmitted diseases and HIV on a regular basis.